These kiddos that are coming to us are sometimes coming to us in the middle of the night, and sometimes they've gone through very traumatic experience, sometimes being released from the emergency room, whether that was physical abuse or severe neglect or abandonment by the parent. One of the things that came very clear to us very early into this relationship with Children's Administration was that they had a higher level of need for health care, and it was higher than what we were used to at the nursery. And so we really utilized our on-call nurse practitioner, Kathy Ormsby, to help us navigate healthcare needs.
Because of my affiliation and employment with Providence, I was able to sort of tap the shoulders of the administration that I work with and know quite well and say, there is this great need. We really need to partner with Vanessa Behan. We need to have a way that we can fast track these kids into care.
We really realized that we need to have a sure, strong relationship with the healthcare professionals in order for us to take good care of these children and to then pass them on to the foster home with already having this basis of healthcare already put together.
One of our Providence nurse practitioners, Kathy Ormsby, will come here and see the children, and then as she decides whether they need to go to an emergency department, can just stay here, or whether they need to be moved to be seen by their primary care pediatrician or family physician, and she will make that happen for us.
In essence, it's triaging what the care needs are for the child and how quickly that child needs to be seen by a medical provider, or what direction we need to go within the community.
Working with Vanessa Behan, working with CPS and the Children's Administration and Providence, we were able to make sure that these children can be seen in a primary care physician's office as soon as possible.
Our goal is to get the child in with their primary care provider. They need to see someone who, depending on the age group that they're familiar with and the setting that they're familiar with, but also they have the medical record. And we want to have continuity of care for the kids. It's the best way of taking care of children. Actually, it's the best way of taking care of anybody in healthcare. If they don't have a primary care provider, or we're not able to locate the primary care provider, then one of our Providence pediatric clinics will see the children. And it's just a quick phone call, and we will do whatever we can to get that child seen by one of our providers.
We're also child-friendly, and we can provide exams in such a way that it's not as upsetting to a child who is under a great amount of stress, having been removed from their home environment.
Some of these kids have been neglected, abused, and we really just want to make sure that we can ease them into the healthcare and do what's right for them. Where in the past, we would see them when they were getting ready to be placed into foster care, or right after they've been placed into foster care. So this is a better relationship. The kids are coming with somebody, and from where they've comfortable, hopefully feeling comfortable, going to the physician's office and coming back to normal surroundings.
They do an awesome job with kids that often have had it very difficult for a long period of time. So we are very lucky to have them in this community.
Our doctors always do their best to take care of kids in need, but having this relationship with Vanessa Behan just brings us one step closer to the children that are suffering in the community.
Both Vanessa Behan and Providence have very similar value systems. Providence believes in compassionate care for vulnerable people. And that's exactly what Vanessa Behan has been doing for over 30 years. And so the two of us together can really make a big difference for the children in our community. There's no question that Vanessa Behan and this program with Providence have saved lives already.